Even under the best of circumstances, it can be difficult for parents to know in their children the difference between challenging behaviors that are just a part of growing up and those that are cause for concern. Especially in this climate we're living in with the COVID-19 pandemic, pediatric and adolescent psychiatrist Dr. Patrick Shea says parents should have a talk with their child about what is going on, but be sure it's an age-appropriate discussion.
For younger children, sometimes parents are concerned or even afraid to talk to them about big, difficult things like the coronavirus crisis and what's going on and things like that. But don't be afraid to talk about it at all, because young children, when parents just refuse to acknowledge it, they tend to assume the worst. So go ahead and let them know what's happening, since they will know that things aren't normal right now. But make sure that you emphasize what we can do to stop and slow the spread.
For older kids or teenagers, try to limit the consumption of COVID-19 related news. Dr. Shea says too much information can lead to more anxiety. Jolinda Thomas is the clinical director for Cornerstone Family Counseling in Oakhurst, and she offers some tips on what parents should do if they suspect their child may be struggling with a mental illness.
So the things that you don't want to do is you don't want to ask, just point blank ask them what's wrong or why are you acting like this. Don't push them to talk if they're not ready to do that. Many children don't even know what they're feeling, and they don't know how to label what they're feeling. So if they say, I don't know, they probably really don't know. So things like, what if we did, or how would it be to do whatever? This would be more helpful. If your concerns persist, in other words, those tools don't work, the child is still isolating or angry, then it's probably important to seek some counseling for a mental health assessment.
If you need additional resources on pediatric and teen mental health, visit samhsa.gov or call 1-800-662-HELP.